We are within the patient record. We are currently undertaking the skin assessment and pressure prevention care pathway. We have started with our screening tools and we have gone through the screening questions, and it suggested that we complete the Purpose T full assessment. So to do that, we go down the steps of the assessment and we will click on the blue link, not around the link. You have to click on the link. So let's click on it to open up. And as you can see, the Purpose T full assessment has been opened, and we suggest that you go from left to right, down and left to right. So we're going to fill these boxes in as needed. So this is analysis of independent movement, and we're going to tick the patient moves occasionally and has slight position changes. In the nutrition box, you can tick all that are applicable. So if your patient's got unplanned weight loss, poor nutritional intake, and a low BMI, you can put all three. But our patient's got poor nutritional intake in this instance. If you look at the must box, so you would do the must before you start your Purpose T. So therefore, your must score and any other risk assessments that have been completed that are pertinent to skin will pull through in this box here. And then we're going to go on to the diabetes box. So we're going to click on the patient is not diabetic. And then we're going to go down to perfusion. Now, again, this is a tick all that's applicable box. So you might have patients with both central and peripheral circulation issues. However, our patient's got no problem, so we're going to tick in that box for now. Then on to medical devices. So this is medical devices that again causing pressure, damage or skin shear at site. However, our patient has no problem, so we're going to click on no problem here. And then we're going to go down to moisture due to perspiration, urine, feces, or exudates. So our patient only has occasional issues, so we're going to click on the first option and go across to sensory perception. And again, our patient has no problem with sensory perception. Underneath here, we're going to go to our patient's previous pressure ulcer history, and obviously if you tick into the pressure ulcer history box, it will highlight all the boxes to fill in, such as number of previous pressure ulcer history, worst recorded PU category, worst recorded pressure ulcer site, and approximate date of other pressure ulcers. But we're going to document that our patient has no known pressure ulcer history. Then we're on to our declined skin check question. So our patient hasn't declined their skin check, so I'm going to click on no. Then we're going to go down to our full detailed skin check. So our patient isn't in any pain at the moment. However, I have noted that the patient is on steroids and has quite thin and dry skin on examination. So I'm going to click on this patient has vulnerable skin everywhere. Then I'm going to go down the form and I'm just going to document this patient has no moisture associated skin damage. And I'm just going to make sure that I'm happy with that my documentation matches the guidance on the left-hand side of the screen. And I'm happy that I've documented correctly in the right place on my skin check, which I'm happy with. So I'm going to click the green tick to sign. And this should take you back to your care pathway. And that is your full assessment completed.